in the last few days, a lot of people have given you a lot of information about corona and the SMS, that is sanitization, mask and social distancing. I'm not going to do the repetition here about all the things that have already been told. I'm also not going to tell you anything about WHO or the pandemic or the epidemic or the endemic that it's going to be over the next 3-4 months. What I'm going to tell you is what to do if you have fever. If you are between the age of 16, 18 up to the age of 50 years, and if you develop flu-like symptoms, which you might because it's rainy season, and other than corona, you have forgotten that there are many viruses which cause the flu. Adenovirus, respiratory syncytial virus, influenza A, influenza B, swine flu. So what do you do when you get fever and cold? So if you develop fever and body ache with or without cold cough, there is first thing that you need to do is stay at home. Put leave for your work, stay at home, buy a thermometer, buy some paracetamol and measure your temperature 3 times a day. Write it down. Normal body temperature is 98.4. Whatever is the fever, 3 times a day take paracetamol, take plenty of rest, take vitamins and stay at home. Now you have to wait for the first 3 to 5 days. Most of the people in most of the flus, including corona, you're going to feel better by day 5. Okay, now at the end of day 5 or day 6, again assess your temperature chart, assess how you're feeling. Now the crucial time is between day 5 and day 8. Remember, 95% of the people who have these symptoms become alright on their own, corona or no corona. So on day 5 to day 8, see if you're feeling breathless, see if you're very, very much tired, see if you're feeling dehydrated, and then you decide to go to a hospital. When you go to the hospital, if you are to be having a corona, they will be doing a swab based on the risk assessment that only a doctor in a corona clinic or a fever clinic is able to do. So don't go to random laboratories, don't go to general practitioners, don't go to nursing homes and beg for corona test. That is not possible. In the hospital, if they take a corona test between the day 5 and day 8, most likely that corona will get diagnosed if it is there, and most likely it will come negative if it is not there. To get your corona diagnosed right, this is the time to go to the hospital. This is for the people who are between the age of 18 to 50. Now, if you are above the age of 50 also, if you are very fit, if you have no comorbids, you are up to the age of 65, 70, you can still do the same thing. Only if you are diabetic, kidney disease, cancer survivor, immunocompromised or any of these diseases, like heart disease, then only maybe you have to see a doctor by day 5. So please, please, please don't rush to the hospital as soon as you get fever. Now the whole system is overburdened with tests being done for people whose tests need not be done. And because of that, test reports are getting delayed and people who have corona, their treatment is being delayed. So this is my honest advice to you people. Remember that 95% of the coronas come and go. They survive. You see United States, everybody, majority of the people when they get cough, cold, they stay at home, wait for 14 days and then get back to their routine. There is no need to test everybody and there is no need to rush or panic if you get fever, cold. This is rainy season. This is the season for flu. In winter months, in rainy seasons, flu is a common thing. And flu is known to mankind from a long time. There are many types of flus. So this is just one additional kind of flu. And this is not something which is a killer. Please remember, if you keep on watching TV, if you keep on watching news, and if you keep on listening to radio and all the horrendous news that comes about corona, you will have the fear that you're going to die of corona. But that's not true. Look at us. We come to hospital every day. We see patients every day. All of us doctors have survived. It's only if you break the protocol, if you unnecessarily go to repeatedly to hospital to get your flu checked, if you keep on again and again breaking rules by not wearing the mask, not sanitizing, socializing and going to crowded places, only then you are at risk. Go to the doctor between day 5 and day 8 of your fever if you still have fever. Go to a fever clinic for testing your corona.